On behalf of our research team, I would like to share with you our findings based on literature review and our own research. My name is Joanna FLICINSKA-TURKIEWICZ and I have honor and pleasure to give you a presentation entitled Oncological Patients' Willingness to Share Data in an Underperforming Healthcare System, the Case of Poland. The research was funded by a grant for the Olivia Foundation from MSD. However, the grant provider had no influence over the design, course, or conclusion of present study. I would like to start with short background information. Collecting and analyzing data is crucial for development in medical sciences as well as for improvement of healthcare systems performance. Patients' willingness to share data is paramount to data-informed innovation in care pathways. This is especially important in oncology, where patient-produced data become increasingly important as advances in personalized medicine are made and many oncological conditions become chronic diseases. Little is known about the factors that influence attitudes of cancer patients to personal health data sharing in an underperforming healthcare setting such as Poland, which could in principle benefit the most from data-informed reform. Our objectives were to address this gap by exploring the attitudes to personal health data sharing among Polish oncological patients and the conditions under which they would be willing to do so. We chose a mixed method study design. The first, following a literature review, 4 variables were identified for further investigation: patient satisfaction with information, patients' expectations of care quality, trust toward the healthcare system, and concerns with data sharing. The second, a workshop with key opinion leaders in Polish oncology was conducted. The third, an online survey was designed and distributed among adult Polish oncological patients and patients' caregivers. The questionnaire comprised questions related to the willingness to share data, satisfaction with information delivered by healthcare professionals, motivation and concerns data sharing, and trust, patients' overall trust in the healthcare system, and patients' trust in medical care they are going to receive. We proposed 4 hypotheses. They are: the first, there is a correlation between willingness to share data and satisfaction with information delivered by healthcare providers. The second, there is a correlation between willingness to share data and trust toward healthcare system. The third, there is a correlation between willingness to share data and patients' expectations of care quality. The fourth, there is a negative correlation between willingness to share data and concerns about sharing data. Now I would like to present the results. The patient's mean age was around 54 years old. The youngest was 6 and the oldest was 92. The majority were women. The majority of respondents had higher education, followed by secondary school, vocational, and primary school level. Most respondents received their cancer diagnosis within the last 5 years. Almost a third of patients had been diagnosed with breast cancer. As for demographic variables, only gender had a statistically significant influence on the willingness to share data. Men declared greater willingness to share data and felt less afraid of it. However, these correlations were weak. Our results are broadly in concord with previous findings, which suggest that patients tend to have generally favorable attitudes toward health data sharing, yet expressed strong concerns related to privacy and security issues. The strongest positive correlation are between the factors of willingness to share data and patient satisfaction with information, which is 0.16. We enlisted several types of information and asked respondents about their satisfaction with them. Factor analysis was performed and verified using Cronbach's alphas. The correlation between the factors were determined using the Pearson correlation. In case of comparing the factor with single individual question, the Spearman correlation was used. More information about our research you can find in our paper, so I would like to encourage you to look at this. Around half of our respondents were generally willing to share their medical data, although more caution was expressed in relation to genetic data. Patients were even less willing to share health-related information gathered by wearables, social media, and mobile networks. Survey participants were particularly wary of sharing location, with less than 13% willing to provide such information. And now I would like to present our conclusions. Patient acceptance is critical for implementing data-driven policy on a national and international level. Understanding of patients' views on sharing of health information, and in particular the patient concerns regarding the safety and privacy of data sharing, is a prerequisite to the effective design of such policies. Satisfaction with information delivered by healthcare professionals correlated with patients' willingness to share their personal health data, as well as their overall trust in the healthcare system and level of trust in medical care they were going to receive it. The strongest was the negative correlation between willingness to share personal data and security concerns. Our study indicates that safety and security concerns may prevail over such issues as overall trust in healthcare, even in an underperforming system. Assuring patients and the general public of sufficiently high data security standards is thus of primary importance. Thank you for your attention. If you have any comments or questions, please contact us using my email address. Is presented on this slide. Thank you very much.